how about you, Dr. Kiran, in the reproductive?
Yeah. In our reproductive science also, AI has come up in a very big way. Actually, earlier we used to think that it's just an innovation and one of the modern things which will come and go. But it's come here to stay actually in our field itself. And all the basic tests which we do, even AI is playing a very important role there also. Right from the time when the patient talks to us from her house also, she is actually, we can give her some AI tools to actually give her history, to track her ovulation. So right from that the starting phase of the ovulation to finally putting the embryo inside the uterine cavity. So I'll just enumerate very, very shortly where it helps us. It helps us to actually tailor our ovulation induction regimes to the that particular person. So earlier we used to give the same dose to everyone, but now AI helps us depending on her hormonal status, on her age group, on the number of eggs she has, that how much dose has to be given. So there we have become very, very precise. Instead of like generalizing the thing, we have become very precise. So naturally that will give us more eggs to actually work on, and in turn finally it will improve our pregnancy rate. Now comes the second phase where it helps us is where we take out the eggs and then start giving it to the embryologist. The embryologist will tell that how many eggs are mature. So this was his subjective assessment. Now we have an objective assessment in the form of the AI coming to help us whether these oocytes are mature or not, whether they are immature oocytes which cannot be used for the ICSI procedure. We cannot inject the sperm inside the egg if it is not a mature egg. So there it is helping us a lot, and the rate at which it tells us is also very high, like 97%. There again it tells us where the polar body is. There is one body where the reduction division has taken place in the egg, and where we have to actually inject the sperm. It tells us the very precise exact point. So there again we are a state-of-art technology where it is going to improve our results. Then finally when we come to the embryo culture, finally when we come to the next day where the pronuclei are formed and fertilization has taken place, it tells us whether fertilization is good or not, whether two pronuclei are formed or not. So there again lot of our work is very eased out. Then we never used to take out the embryos very, very quickly and at regular intervals, because that spoils the embryo quality when you are taking them out of the incubator. But now we have AI backed tools which are called as embryoscopes, and which tell us the time lapse imaging of the embryos. So as the embryo divides, every 10 minutes it takes a picture. So it's humanly impossible to go inside the incubator and take that picture. The embryologist will take it out only once in 2 days. But here it is doing it for us every 10 minutes. And finally, all that 5 days when we grow the embryo, it is going to give us a video of that. So many pictures, And there the AI tool in our lab itself will learn from that. Because, data is also very important. So, like whatever we imagined and did not imagine also is happening. Finally, which embryo to put inside the uterus? See, there is a big, something called as, embryos are put on the slide. And then he says, this one, madam, that one, which one should we put like? So it's again a subjective assessment. But here AI is able to give us with a correct information about these embryos, that 97% efficacy of correct saying, all look similar. So it's like a beauty pageant, everybody is going around and you say which one is the best among them. So finally that also is decided by that, but I don't know how far when you'll be asking those questions again maybe, so we'll answer that.